Support for Radio Friends comes from Columbia Healthy Smiles, the dental office of husband and wife team Dr. Batson and Dr. Abe, offering comprehensive and customized care to patients of all ages. Learn more by calling 573-721-9039 or online at www.columbiahealthysmiles.com. Good morning and welcome to Radio Friends on this Wednesday, June the 9th. We're going to talk about a really important topic today. You know, April is Organ Transplant Month. Well, this is June 1st, but really anytime you can talk about organ transplant is important. I want to introduce you to Joe Weston, who's been on this show many times, from the Columbia South Side Rotary Club, right?
South Rotary Club,
and
right.
A big promoter of organ transplant. And then we have Dr. Mark Wakefield from University Healthcare. Good to have you here.
Thank
Doctor.
you. Good morning.
Thank you. Good to be here.
When we talk about organ transplant, I think the first thing that comes into my mind is heart or kidney. What is the number one transplant that's done?
So the most common organ transplant that's done in the United States is kidney transplant.
Kidney. I would have thought it was heart. But almost any organ can be transplanted, correct?
Yes, that is true. The most commonly transplanted organ is a kidney. And one of the reasons that's the most common is we have a good treatment for end-stage renal disease.
Yeah.
So your patients are maintained on dialysis until a kidney becomes available. So you can facilitate survival of the patient until a transplant becomes available.
Now, I was looking at a list that you had sent. You can transplant intestines, expanded liver, multiple simultaneous transplants. And what is the newest that you're doing now?
So the newest type of transplant that's getting a lot of attention and is prior to COVID was the fastest growing is uterine transplant.
You're doing uterine transplant.
So select centers in the United States are doing uterine transplants. This is a type of transplant which we call a vascular composite allograft. And people have heard about this when they've heard the stories about hand transplants or face transplant. And the same technology is being applied to uterine transplantation.
What do we, as people who are interested in donating their organ once we've passed on, what do we need to know?
That it's really easy to sign up, and most Missourians, we're very generous Midwesterners, have signed up. You know, very generous Midwesterners go get their driver's license, and they say yes. You can also do this on the web. There's a web page. You can go to Midwest Transplant Network, and they'll facilitate getting you to the network. So it's very easy to do. But the reality is it's very unlikely that any of us will become an organ donor.
And why is that?
Well, the circumstance of death that is necessary to be a successful organ donor is quite unusual. It has to be facilitated at a hospital as it currently stands. And the circumstances, the reasons why have to be totally lined up. So it's very unlikely that any of us will be in that situation.
But you never know.
That's correct.
You never
just
know.
in case.
So it's important to go ahead and sign up on your driver's license and let your loved ones know that you want to be an organ donor. Now, if you die at home, chances of being an organ donor are
pretty unusual for that to.
What about the cornea? I read somewhere that it doesn't have to be transplanted immediately.
That is true. So there may be circumstances where that can be facilitated. But in general, dying at home, which most of us think that's what we want to do,
right,
is not consistent with the pathway to being an organ donor.
How has the coronavirus pandemic impacted transplanting?
Well, initially, like many other things related to COVID, we didn't know what the risk was. And for those organs that delaying transplant, so diseases that transplant can be delayed, most centers decided to take a cautious approach. And many big cities, they were overwhelmed and they didn't have the resources to do transplantation or organ donation. So it was dramatic impact. And probably the most dramatic thing over the last year is a decrease in the number of living donors. So the most commonly transplanted kidney live donor is a kidney, and that's usually scheduled and very methodically planned out. And we did about 20% less living donor kidney transplants because of the COVID virus.
The heart, though, the person has to be deceased to make the. You can't take part of the heart like you can.
You can do part of the liver, and you can do 1 out of 2 lungs. Now that's a pretty rare live donor scenario. And uterine transplant can be done with a living donor. But heart transplant is a deceased donor, and the patients who are in need can't wait. So we didn't defer very many patients in need of a heart transplant.
Okay, I think you've summed this just up beautifully. The important thing we do need to keep in mind is if you want to be a donor, and remember you're giving life. You're giving life. Sign up on your driver's license, or you can go to the web page and sign up. Or where do you go?
I would go to the Midwest Transplant Network. That's our organ procurement organization, and they can facilitate a link to getting you to the state website to get registered.
Okay. Joe, anything else that you want to add here?
Some of the increase in success has exacerbated the donor registry shortage problem. And it becomes more and more necessary and essential for more people to sign up because more organs are being used. Somebody said the other day, a friend of mine said, don't take your organs to heaven. Heaven knows we need them here.
That's good.
That's great.
I
thought that was a nice little way to say it.
You have worked so hard to get the word out, and you got a special recognition, didn't you? Tell me about that real quick.
Well, people in different regions of the Midwest Transplant Network sometimes get nominated for recognition awards, and I was lucky that Lori Clark and the folks here did that for me. But it was really on behalf of the late Tom Thomas, who got us started, other people who recognize the importance of signing the organ donation registry and support it.
Well,
and
Joe,
we appreciate that from you.
I appreciate everything that you have done. And Doctor, I thank you for coming by today. It was a pleasure chatting with both of you, and please come back again. Because you've got important stories to tell.
Yeah.
Right? We're about out of time for today, but again, if you want to sign up, remember when you renew your driver's license, you can do it with the motor vehicle, Division of Motor Vehicle, or you can go online on the webpage. All right? Thank you for joining us today, and if there's something you would like to hear or see, I would love to hear from you. Just drop me an email. That's pepperp@missouri.edu. Go out and be nice to each other.